Let's go live now to Brad Hazzard, the New South Wales Health Minister. Minister, thanks very much for your time. Can I start by just getting an update from you as you see it right now, the situation in New South Wales? How many cases, and are you worried about this increase that we've seen in the last 24 hours?
In the last 24 hours, the cases have increased far more than previously. We've had an increase of 37 cases since 11 a.m. yesterday morning, and that's taken us to 171 cases. Of those, 67 were imported from overseas, and about 40 odd we know were transmission on soil here. The others are either under investigation or we're just not certain yet with the tracing and so on. But certainly it's concerning, but it's also reality. If we look at what's happening across the world, you'd have to expect that we will see an increase. And I think the fact that people are coming forward is a very positive thing. I want to thank the community for that, because people, I do get the impression here in New South Wales that there is a true partnership in our community between health and the community, and they're coming forward and they're not fearful of coming forward. So thank you, and I would encourage people, if they are feeling ill and they've come in from overseas, or they think they've had a connection with COVID-19 in some way, to get some medical advice. And certainly if the medical advice is to have the appropriate tests, we'll have them.
And do you think that it's realistic for us to be aiming to flatten the curve? It's a language that we've been becoming used to over the last few days,
yes.
But this idea of flattening the curve is to avoid a spike, which then puts too much pressure on our hospital systems. Can we achieve that?
Well, we're certainly working towards that. The government is working towards that, but most importantly, our amazing frontline health staff and the public health staff are working towards that. If I could just explain that, hopefully in simpler terms. If we get a whole lot of people suddenly with this disease and they have it badly, and that's not necessarily the case at the moment, 80% of people worldwide get it quite mildly, but if we did, and we had a whole lot of people coming into our hospitals across the country, that obviously puts a lot of pressure on it. So what we're trying to do is take measures to stop that virus moving across the community quickly. If it moves at a more moderate pace, we're not probably going to stop it, but we can slow it. It just means that over the next 6 or 8 months, our hospital systems aren't going to be inundated. And I think that's a really positive way of going about it, and so far it seems to be working. I stress that it's terrible when we have anybody pass away from any disease. At this stage, though, we've had five people die across Australia. There was 1 in Western Australia and now 4 here who've been connected with the virus. But in each case, they were not in that sort of middle to younger bracket. They were older people, and they did have some comorbidities. As I said, I'm really sorry. I think it's awful for the families, and it's a bit sad that we have to even talk about them publicly, but that helps the rest of the community understand what's going on. The bulk of young people who get this, particularly younger people, so teenagers and so on, appear to get it in a very mild way, if at all. So it's certainly not the target area. I think my advice from the health authorities is that older people should be very cautious, and particularly if what the doctors like to call comorbidities, but basically means if you've got a few other problems like diabetes or heart condition or lung condition, you want to take it pretty carefully. Maybe try and stay away from any groups at all of large nature. I heard Andrew say that depends on, or it may not make a difference as to the size of the crowd. It does, because, and I respect Andrew a lot, but if you've got a big crowd and there's 1 or 2 people moving amongst a big crowd, then obviously that person or persons are likely to spread the disease amongst a lot of people. Whereas if you've got a small group of people, it's not going to get spread so far.
Yeah, indeed. And in terms of that issue that you raised there, let's pick up on that, because there's a suggestion that the National Cabinet, which is a really interesting, I think, worthwhile initiative to be meeting so regularly on this issue, but is it heading towards greater restrictions in terms of those gatherings that are held indoors?
Look, the way it works at the moment is that every day, and it's been this way for now probably a couple of months, maybe longer actually, a group called, they love acronyms in health, it's the AHPPC, but basically it's all of the senior chief health officers from around the country, and a lot of other specialist medical practitioners and advisors with medical background have a discussion at about usually 2 p.m. a day, and they feed that information up to the National Cabinet, which consists of all the leaders of our states and territories, and of course our Prime Minister, Scott Morrison, our Premier here in New South Wales, Gladys Berejiklian, but also to the health ministers. They give advice, and I think to the very great credit of our system, our politicians do rely very much on the health advice. We might be able to communicate the message in some ways to our community, but the doctors, the virologists, the specialists do give that advice, and the politicians, the leaders, take that advice. So at this point, I think we're just taking each day as it comes.
One of the bits of information we've received today, the South Australian Chief Medical Officer talking about the situation with schools. It's not as simple as saying we shut them down, because the experience overseas has been, in fact, that the transmission rate at school level hasn't been there. It hasn't been a great issue, apparently, from what they can gauge. So it might be counterintuitive, but the idea that you shut schools could actually make the situation worse, Minister. Is that fair to say? That's very fair to say, Kieran. Based on the medical advice, and I've now spent probably thousands of hours in the last few months talking about all these issues, but I don't know how many hours just on the weekend talking with the Chief Health Officer about that sort of issue, along with other specialists. And the view is very solidly at this stage, and it's evolving, but at this stage, it's far more sensible to keep our children in the schools. There's been some steps taken to say, cut down on some of the real proximity, so don't jam them in on top of each other in assemblies and so on. But even if they do get the virus, it appears that it's very mild. And in fact, some health senior practitioners are saying it may even help, in a sense, the older community eventually, because younger people might get it, we might not even know because they just get it so mildly. But that all goes to the eventual, say, 12 months from now, herd immunity, what they call the overall community immunity. But certainly no suggestion here in New South Wales at the present time that it makes sense to move the children out of school. In fact, in some ways, sending them home and having to be be babysat, for example, by grandparents who are more vulnerable, doesn't make a lot of sense for the overall community or for the kids. No, it doesn't. And I know earlier in the day you were discussing some of the penalties that might be enforced. Obviously, we're not expecting that to be the case, that people will breach these, certainly the mass gathering rules, but can you talk us through the penalties that would be put in place in terms of self-isolation and in relation to the mass gatherings?
Yeah, well, look, in the last 24 hours, I, as Health Minister, have invoked the emergency powers that we have under the Public Health Act here in New South Wales. I did that again on advice from the Chief Medical Officer here in New South Wales, and one of those was to say that mass gatherings of 500 or more should cease. So a typical example would be a music festival, and those people, if the organisers were to go ahead, they would be liable, the company would be liable to a $55,000 fine on day one, and then $27,500 for every subsequent day. So it's not something that they would want to be doing. And I think generally they are responding, again, as really true partners of the community and the government, so I don't see that as a huge problem. But the other one you mentioned is the second order, also made under our emergency powers here under the Public Health Act, and that's in regard to returning travellers. And all travellers coming in to Australia, particularly through our Sydney gate, and we are the main gateway to this great continent, those people are being told now that you must go home, you must go to your residence, and you must self-isolate for a period of up to 14 days. I stress the reason for that is that if you've actually had contact with the COVID-19 virus, the coronavirus, it normally takes somewhere between about 2 and 14 days for it to manifest. So you start getting the symptoms of, a runny nose, a cough, a cold, respiratory, difficulty breathing. So that gives us that 14 days for those people to be at home, and we've got some guidelines that Health are making sure are up on the websites, just how they do that. Obviously, there is a penalty. We're hoping we don't have to impose the penalty. We're hoping people do what they've generally been doing, which is playing a very decent part of the partnership of our community. And they go home, they look after themselves for 14 days, and at the end of the 14 days they can come out and do all the things that are necessary. But if they don't, if we get somebody who doesn't, then I guess they should know very clearly they're liable for an $11,000 fine and or 6 months jail. And I must say, whilst our government here in New South Wales, and I don't believe any government in Australia wants to impose that, certainly it's there, and be very wary if you're not one of our partners in the community. You're somebody who thinks it's okay just to do your own thing. Well, it's not. This virus knows no bounds, and we're trying to put a boundary around this virus, and everybody has their part to play in that boundary.
Indeed they do. Minister Brad Hazzard, thanks. New South Wales Health Minister Brad Hazzard, appreciate your time.